Hi, Nikki. This is Matthew. Nice to see you again.
Hi, Matthew. Good morning.
Hi, good morning.
Am I audible and you're able to hear me clearly?
Yes, I can hear you clearly. Can you hear me?
Yes.
Yes, my name says Lauren because I'm using Lauren's Zoom account.
Okay.
Hi, I'm from
Hello.
AppCom.
Hello, nice to meet you.
Yes, and I'm with Prayun from M Plus.
Hi, Nikki.
Hey, how are you?
Great. How are you doing?
I'm good, thank you.
Great. Thank you all for
Matthew,
yes.
sorry, I will be sharing the screen from my side because I just made some minor edits in my presentation, if that's okay.
Yes, so I think all of you can share your screen. สวัสดีครับ
Good morning, everyone.
Good morning. Yeah, so I think you can all share your screens when it's time to present, but I have a copy, so in case there's any technical difficulties, then I can do it. I can share from
Yeah,
my
but before you circulate it to everyone, just wait for me to send you the revised copy.
Will do. Great, so I'll start letting other people in. Is that okay? Great, so I think we can get started. Thank you all for joining. My name is Matthew Kuzin. I'm the Senior Technical Officer for Monitoring, Evaluation, and Learning with the SKPA 2 project based in Bangkok, working for AFAO. So in terms of today, thank you all for joining. We'll be talking a bit about innovations and virtual interventions for HIV self-testing. So this is a bit of a webinar, as well as we'll have a participatory session closer to the end to allow it to be a bit more interactive, so that you can maybe use some of the learnings today and adapt it or think about it in your own context and country. So in terms of just giving a brief kind of welcome right now to the webinar, as well as a brief overview into what we'll cover today. And so first, we'll have a presentation from Purvi Shah, who is a consultant for UNAIDS regional support team for Asia Pacific, as well as WHO HQ. And she'll be talking a bit about HIV self-testing, as well as best practice and international guidelines. Then we will hear from Prayun, as well as Arm from M Plus Foundation and AppCom, who will give a bit of an overview of their program for HIV self-testing and test BKK, and so using virtual interventions around HIV self-testing. And then we'll also hear from Nikki Sullivan, who works for the Connect project officer with the Mesh in Australia, talking a bit about their HIV self-testing vending machine initiative and pilot project. And then we'll have a bit of a Q&A afterwards. So feel free to also pop your questions in the chat, but then we'll also have time where we can have a Q&A afterwards. And then we'll have a bit of a participatory session where we'll be using Jamboard to for that session. And so I'll give you a bit more details, and I'll also pop in the Jamboard link in the chat so then you can open and have access once we get to that. And then lastly, we'll have a closing remark from Mike Merrigan from AFAO around the reflections and way forward. So yes, please keep your microphones muted and feel free to raise your hand. And then also you can pop in any questions in the chat box, and I'll be monitoring that as we go. So without further ado, I will hand over to Purvi for our first presentation. Thank you.
Thank you, Matthew, for the introduction. Just give me a second while I share my screen, and if you can just confirm if it's visible.
Yes, we can see this portion of the PowerPoint now. So I think if you put it on full screen, yes, we can see full screen now.
Okay, great. So a very good morning to everyone, and thank you for giving me an opportunity to speak at this webinar. I think today's topics are very, very important in terms of the direction that we need to take as part of the HIV program. So my presentation today is going to focus on HIV self-testing. I'm going to talk a little bit about policies, guidelines, WHO recommendations, also a lot of innovations that have come into being with regards to HIV self-testing and combining it with virtual interventions, and how virtual interventions can be used to promote and provide access to HIV self-testing and other services as well. So first and foremost, I mean, every time I visit a country and I get talking to organizations, I see this fundamental issue with people's understanding of what HIV self-testing is. And I think it's important to clarify this at the very beginning, because you need to start planning your interventions based on what the actual approach means to do. So self-testing is mainly when the person himself or herself collects his or her own specimen, performs a rapid test kit, and interprets their own result. This means that we do not take any assistance from anybody else in terms of performing the test. Somebody can guide you before you actually conduct the test. Somebody can help you interpret the results later on. But in terms of actually conducting the test, it's supposed to be done by the person himself or herself. And so a lot of times in countries, I've seen that community-based testing is often mixed with HIV self-testing, which is not the correct way to do it. I understand that countries have limitations in terms of their laws and policies, where lay providers are not allowed to conduct tests. And therefore, you take help of healthcare providers to conduct tests for people. But in terms of the real definition and the approach as recommended by WHO, requires the person to conduct his or her own test. So just to quickly give you a snapshot of how the algorithm works when you have HIV self-testing added to it. So self-testing plays a screening test role where you screen the person for HIV using an oral or a blood-based test kit. And if found positive, you refer the person to a confirmatory testing center, or if found negative, you provide a prevention combination package, or you call the person for a retest after a certain period of time based on the risk of that individual. In terms of what are the ways in which services, we need to broaden the way we offer services to people. So it is important that we try to incorporate testing services or the way we provide services in different components of the HIV program. So starting from reach to recruit, there can be a bouquet of services or a variety of approaches that can be used, or a variety of options that can be provided to people for testing, for prevention, for treatment, for reaching people also, there can be various innovative approaches that can be used rather than using the same traditional way of reaching people, which I think now is quite outdated, and we need to move on, based on the kind of approaches that key populations now prefer to use in terms of being reached or being given access to testing, treatment, prevention, etc. So WHO recommends various different testing approaches. Here is a list of various approaches that have been recommended by WHO. Facility-based testing, I think everybody understands, where a person goes to a facility to get tested. Community-based testing is where in a natural setting of the community, whether it's a health camp, a CBO office, a bar, a club, an outreach camp, where testing is offered to priority populations. Provider-assisted referral refers to a form of index testing, but where the provider is involved in referring the spouse or the partner for testing. Social network-based approaches are more like the key population offering testing services to their own spouses and partners, basically informing them that we can be at risk and it's important to get tested, and gets them into the testing program as well. And the last is HIV self-testing, where we are offering a self-test kit to an individual or their partner, letting them collect their own sample and interpret their own results in privacy. So all of this, when we talk of self-testing, when we talk of virtual interventions, they all fall into the realm of self-care. So when we talk of self-care, it means that we are empowering an individual to take, health, even if it is prevention, even if it is maintaining their own health, or coping with an illness or a disability with or without a healthcare provider. So basically, you're empowering the person to take decisions based on their risk behaviors. You provide them with that option that they can take their own decisions as to whether they want to get tested or not, where do they want to get tested, what kind of kit they want to use, and what do they want to do moving forward in terms of prevention or treatment. It's like a whole arrangement that we can offer in terms of self-care options. And self-care and self-testing today is extremely critical to the health system, because I think that our health systems are already overburdened in terms of the number of people that access health systems, and because of which the quality also suffers. There are long waiting times. There are times when people do not get access to services because of time issues or stigma, discrimination, etc. And it is important that self-care options be provided to people to increase efficiency, to reduce costs, to reduce the burden on our healthcare providers, and to also increase access and equity in terms of all the options that are provided to key populations or vulnerable populations. So this is just a roadmap that we have crossed across all these years, where in 1986 the first HIV self-test kit was discussed. I know this slide is a little busy, but I'll just highlight a few key things, where just to show the journey that one has taken to come to this stage. And so, WHO reviews HIV self-test testing in 2011. In 2016, we had the first guideline. 2014-15 was the first guideline. 2016, WHO recommended self-testing as a testing approach. And in 2019, we also have a revised guideline for HIV self-testing as well. And now currently we have 6 pre-qualified HIV self-testing kits, which I'll talk to about in the next slide also. Now, a lot of arenas have opened in terms of different other diseases or illnesses also taking on to self-testing, like COVID. There's STI self-testing, hepatitis self-testing. There are various things coming in to provide self-care options to people now. So what does WHO recommend in the 2019 guideline? So it says that HIV self-testing, it has increased. The evidence that showed as part of when we updated the guideline, the evidence that came up was that it has increased uptake and frequency of self-testing, of HIV testing among those at high risk and those who may not test otherwise. So self-testing is, as per WHO guidelines, is usually offered to people who would otherwise not come to a facility to get tested. The unreached, never tested, non-identifying populations are the ones that can be reached through HIV self-testing. And it was therefore recommended that HIV self-testing should be offered as an approach to HIV testing services. It should be, of course, the decision of the key population or the client, but it should be offered as an approach of self-care. So there are various evidences and studies that have taken place to look at the effects of self-testing as compared to standard HIV testing for key populations. And we see that, there in all these tests, we've seen that there has been an increase in testing among people who were never tested before. And therefore, the evidence that we see and the guidelines that have been created based on that strongly recommends HIV self-testing as an option for key populations. So here, I mean, there are various evidences. I don't want to go into the detail, but basically tells a story about, how various different approaches have been used in the past, like secondary distribution through peers, facility-based distribution, or online and mail distribution. And all of them show that it favors HIV self-testing in terms of an approach to be offered to key populations. Another study in 2020 shows that, HIV self-testing more than doubled positivity compared to standard testing. It also shows that online and mail HIV self-distribution was preferred as compared to standard pickups or any other standard forms of testing. I'm not going to spend too much time on evidence, but I wanted to spend a little time on costing, because I think that this is a question that most countries have as to what will be the cost incurred if we have to implement self-testing in our country, and if it has to be integrated into the national program or budgeted into the Global Fund proposal. And this gives you like a snapshot of what are the ranges of different kinds of approaches that one can use for offering self-testing or testing approaches based on, general population or key population. This has been divided between low to upper middle income countries and high income countries. And then you can see some median ranges, which will give you a fair idea about, what's the kind of cost per person per test done, so that you are able to calculate based on your targets for your country in your country context. Currently, we have 6 pre-qualified WHO kits, WHO pre-qualified kits, out of which 1 is an oral self-test kit and 5 are blood-based self-test kits. The cost ranges from $1 to about $3 but now one of the WHO PQ kits is now available, which is available for $1, which I think is like a game changer for countries that want to implement and scale up self-testing for improving their testing amongst their vulnerable priority populations. Just to give you a snapshot of where we are in terms of national policy and implementation of HIV self-testing. So as of now, 98 countries have national policies which support HIV self-testing, and 52 out of them are routinely implementing self-testing as well. When I say routinely implementing, it means like a normal national program implementation, not a pilot or a demonstration project. And another 30 are in the process of developing policies. This is a region-wise distribution of what's been the status of HIV self-testing policies, implementations, demonstration projects, etc. And if we currently focus on Asia and the Pacific, we are seeing that only 20% of the countries are currently implementing HIV self-testing, and a majority of the countries do not even have a self-testing policy in place. So we've just tried to, bring about a forecast in terms of low and middle income countries as to what would be the requirement of self-testing kits in the coming 3 years. And we see that 190 million unmet needs, very importantly indicate that there is a need of investment and also more low-cost products, which would be more affordable for low and middle income countries. And therefore, it is important that we add self-testing as part of our Global Fund proposal or as part of our national program or domestic funding, even if it is a part of the entire budget, it's okay. But there needs to be a start there needs to be a beginning in terms of sustainability and integration of self-testing into the network. There are various ways in which, and there are various support tools that can be used for self-testing. These are all available. A lot of it is available online, and there are various videos, there are various hotlines that countries have developed. There are messages, there are educational materials that run constantly on radio, television, there are brochures, leaflets. There are different kinds of educational awareness, demand generation materials that have been created on HIV self-testing, also demonstration videos for people who want to take the unassisted HIV self-testing option. I think these support tools have been developed in various languages in various countries, which can be made use of, which can be adapted in your country context as well. When it comes to self-testing, I think, what should be you in your country context should be thinking of how self-testing could be used to increase case finding. So here are some examples. There can be more based on your country context, but these are some examples where, we can use self-testing in high HIV burden settings to increase our coverage. It can be, used to replace screening tools. It can be used among key populations, like I mentioned, non-identifying populations, especially on social media, where people don't want to come to a facility and identify themselves as key populations. It is very important to give them an anonymous option where they can order a self-test kit online probably and just get themselves tested. I think it is more important to allow a person to know their status rather than, not getting them to a test at all. And so it is important that we provide a bouquet of approaches, a bouquet of services, and let the person choose how they want to access that service. With regards to, how HIV self-testing could be a part of prevention. So there are various combination prevention packages that have been used by countries, which includes, using self-testing for PrEP initiation, continuation, partner testing for VMMC, like a prevention combination package of services, which includes VMMC, condoms, PrEP, harm reduction. So, based on your priorities, your population, and your country context, a package of service can be developed where self-testing can be used alongside or helping a client initiate other services based on their status and results. Now, you all must have heard about virtual interventions, and we always talk about virtual interventions when it comes to, reaching out the non-identifying populations. And so what are virtual interventions? They can be any kind of internet or phone-based ways of communicating with people. Many times countries feel that this is not affordable for us, but very low cost phone-based approaches of virtual interventions can also be used by countries to ensure that at least we are reaching out to people with the right messages, we are reaching out to people with the right services. And as you can see in these data charts, a huge number of people around the world are social media users. The amount of time that they spend on social media is much more than they would do a normal other task. And I think it's important for us to leverage this opportunity to reach out to people through the method that they are most comfortable with, which is social media and through virtual approaches. Just wanted to highlight that HIV self-testing has been named under the HIV program essentials in the Global Fund current round, which is Global Fund Cycle 7. It would be important to plan HIV self-testing as an approach in your proposal as well. Now I'm going to give you a quick review of some examples where self-testing has been used, with the help of virtual interventions or in combination of virtual interventions. This is a self-care unassisted HIV self-testing program by Philippines, the Love Yourself. And as you can see in the graph, there a lot of people received self-testing kits in 2021-22, but reported results, there is a sharp drop. Screened reactive is again a sharper drop, and then linked to confirmatory testing also there is a large gap. So, WHO does not mandate that everybody needs to inform their results back. It is more important that the person gets access to a self-test kit and gets tested. Although there can be robust technology or robust methods that can be used for following up with clients to report their results, and so that we can link them to treatment services. But it is not mandatory for a person to call up or revert back with a result if you have used a self-test kit. This is an example from Mongolia. Quickly, again, another platform that was developed called Test for UB, where a demand generation campaign was run for HIV self-testing and PrEP. There was a good uptake of HIV self-test kits through the virtual platform. There was a lot of positive feedback that came in from the clients who used it as well. Bhutan as well has started using self-testing and virtual interventions to provide options to people. There was a demonstration. I wouldn't call it a study, but there was a demonstration project that was done in Bhutan, which allowed people to order self-test kits. And it was important. I mean, Bhutan has now included self-testing as part of their key population program, and pre-test information, post-test counseling, etc., is all provided as part of this program as well. Sri Lanka has a comprehensive platform called knowforsure.lk, through which they offer various services, including HIV self-testing, ordering and delivery to a convenient location. They offer free health commodities and which includes HIV self-testing as well. And virtual outreach workers are trained to create demand, to follow up with the clients, and also track in terms of real-time data. This is an example from Vietnam where differentiated service delivery is used through virtual interventions for HIV self-testing. And so, there are different types of options that are available for clients to choose from, whether it is what type of product they want to use, what test kit they want to use, what is the distribution outlet they would like to choose, whether they want to get it delivered or they want to go to a facility and access it. They want to do it by lay providers, or they want to do like a secondary distribution. They want to do assisted or unassisted. There's a differentiated service delivery approach that has been very, very successful in Vietnam. And a lot of people, there has been an increase in uptake of self-testing kits because so many options have been provided. This is quickly, the uptake of self-testing kits. I can just run through this. These slides are going to be provided to you and you can look at them more carefully. This is another example of using virtual interventions for self-testing kits in Vietnam, where it is very easy to order a self-test kit, do a risk assessment, get a test kit delivered, and you can upload your result on WhatsApp or on Zalo within 7 days. And if not, then the client, the virtual outreach worker would get in touch with you for your results. Similarly, self-testing has been used for PrEP initiation as well. So when someone orders a self-test kit, they are also told about PrEP initiation. And as you can see, 51% of the people who screened ordered a self-test kit, and 26% of them even got enrolled into PrEP when they booked a PrEP appointment. 26% of them even enrolled themselves into PrEP. When we did an online survey on teleprep, it was seen that a lot of clients were selecting self-testing as a method of testing themselves before initiating PrEP or continuation of PrEP. And as you can see, 95% of the people, used a self-test kit at home as part of the telehealth PrEP program. And then also 96% said that they would prefer to use a self-test kit in the future as well. Again, some examples. I'm not going to run through all of them. Some key takeaways from my side would be that self-testing is now the new normal. It is important that we provide that self-care option to people. It is important that we expand the self-testing products that are currently available. New evidences needs to be generated. New prevention-focused testing should be planned. And more disease areas are also adopting self-care and self-testing approaches. Like I mentioned, STI, hepatitis, COVID are some examples. And what we need to do as a program in our countries, it is important that our country has a national policy and they are using quality assured products, which are the WHO PQ products. It is also important that we ensure that there is adequate and improved access of self-test kits. It is important that we provide affordable kits to people if they are available in the private market. And also advocacy plays a very important role. A lot of people do not even know about self-testing kits, that they're available, and they are available free or at whatever cost is available. But it is important that we continue providing key messages to the community so that they are able to understand and choose it as a self-care option. I would like to thank the entire team for all these slides and all the partners for providing the slides. And if there are any questions, I'll be happy to take them. Thank you.
Great. Thank you so much, Purvi, for that comprehensive presentation. It was really useful to hear. And maybe we'll hold off on the Q&A after all three presentations. But if you have any questions in the meantime in the chat, please feel free to include those. And Purvi might be able to respond in the chat while we wait. So next up, I will hand over to Prayun as well as Arm from M+ Foundation and AppCom to share their presentation around HIV self-testing in Thailand.
Good morning. I'm Siripong Sishia from AppCom Foundation, and I'm with Prayun from M+ Foundation. So first of all, I would like to share Testpicate website that we run the campaign for our key population to encourage them to get a blood test via this platform. So in this platform, yes, the first thing that they can have is like to click on and get the free blood test from our clinic partner. And so we give them the knowledge about sexual health, that in the main topic that we have about safe sex, HIV self-testing, U equals U, drug use and health, STI, and the information about blood tests. And also we have like the party pack and sexual consent also. So in HIV self-testing, we are like the hub for that knowledge. They can search in the Google and it translates in local language for them to get the knowledge, like how many types of HIV self-tests that we have now, and where can they find the HIV self-test, and can they use like PrEP with HIV self-test also. And for today, I bring one of our clinic partner that in Chiang Mai, that is Kun Prayun from M+ Foundation, to share the implementation that happened in M+. So I would over it to Kun Prayun and I will translate in English.
สวัสดีครับครับประยูนนะครับ ก็เป็นเจ้าหน้าที่ภาคสนามนะครับที่ทำงานดูแลเกี่ยวกับเรื่องของ HIV self test ครับ
And he is Kun Prayun. He worked as a field staff with HIV self-test.
ครับแล้วเดี๋ยวตอนนี้ขอรบกวนให้แชร์สไลด์ไปที่สไลด์ของ HIV self test ใน M+ site ด้วยนะครับ
Okay, so please share the slide for Mr. Prayun, please. Okay.
ครับสไลด์ถัดไปเลยครับ ก็เราเริ่มด้วยการทำเซลล์เทสนะครับโดยการใช้วิธีการ reach ออนไลน์นะครับ
Okay, we start the self-testing by reaching online.
ครับโดยช่องทางออนไลน์ต่างๆนะครับในสไลด์ถัดไป
By using a lot of channel in online.
จะเห็นได้ว่ามีแพลตฟอร์มโซเชียลมีเดียหลายๆแพลตฟอร์มที่เราใช้ทำงานในการ reach.
And we use various kind of social media to reach the people.
ครับอย่างเช่นใน Facebook เนี่ยครับเราจะโดดเด่นในเรื่องของการที่เรามีเพจ Facebook เป็นของตัวเองและเราสามารถโพสต์สื่อต่างๆไปที่เพจของเราครับ
And they use the Facebook fan page to post about the knowledge and HIV self-test information.
ครับแล้วเรายังมีการสอดแทรกการประชาสัมพันธ์เรื่องของ HIV Self Test ผ่านการไลฟ์นะครับเพราะว่าเรามีรายการถึง2 รายการด้วยกัน
Okay, and they do it by live to give more knowledge about HIV self-test with 2 programs that they live.
ครับและเมื่อเวลาเราสตรีมออกไปเนี่ยครับแล้วก็เวลามีคนคอมเมนต์เข้ามาเพื่อที่จะสนใจชุดตรวจของเรานะครับเราก็ทำการทักไปโดยส่วนตัวนะครับเพื่อที่แนะนำบริการ HIV Self Test ให้แก่เขา
And when the people get interested by live, and the staff will DM for them and give them more information and send the HIV self-test for them.
แล้วก็ยังมีช่องทางการได้รับเคสเข้ามาจากช่องทางอื่นๆอย่างเช่นLine Account นะครับ
And they can have more case in other social media too, as Line application, that is the messaging application in Thailand.
ครับในส่วนของเว็บไซต์ของเรานะครับก็สามารถเสิร์ชได้จากการเสิร์ชใน Google นะครับแล้วเมื่อมีคนสนใจตรวจHIV Self Test เนี่ยก็สามารถเข้าติดต่อผ่านทางเว็บไซต์ของเราได้
And also they can search and find the information about HIV self-test from Google and can visit the information from M+ also.
และอีกส่วนหนึ่งก็คือเป็นส่วนของ Gay Dating Application นะครับแล้วก็ใช้ CBS ในการทำงาน เพื่อที่จะติดต่อกับผู้รับบริการได้นะครับ
And another channel is from Gay Dating application like Jack D and Hornet that can reach to the case too.
ครับแล้วก็ทั้งหมดเนี่ยครับเราจะลิงก์ไปสู่การให้บริการผ่าน Test Me Now นะครับโดยการให้เคสเนี่ยจองเข้ามาเพื่อรับบริการชุดตรวจ HIV Self Test
And from the online channel, we will link it to Test Me Now platform for them to book the testing and get the HIV self-test.
ครับและเดี๋ยวเราไปดูตัวอย่างในสไลด์ถัดไปนะครับ
We can see the example in the next slide.
อันนี้เป็นตัวอย่างที่เราทำในแพลตฟอร์มจากทางซ้ายนะครับจะเป็นTwitter ของ M+ Thailand นะครับ
Okay. And this is the example from all platforms. Start from the left, that is from Twitter.
โดยทั่วไปแล้วนะครับเราก็จะมีการวิเคราะห์จากสื่อประชาสัมพันธ์ที่เราทำไปนะครับคือถ้าเกิดว่ามีสื่อแบบไหนที่ได้รับความนิยมมีคนกดไลค์หรือมีคนกดแชร์เยอะนะครับเราก็จะใช้ลักษณะของโปสเตอร์หรือว่าอาร์ตเวิร์กแบบนั้นนะครับมาใช้ในการประชาสัมพันธ์
So after posting, they got analyzed, and if that post get most interact, they will develop from that post into the poster and make the artwork that corresponding to that post because it can get more people.
อย่างเช่นตัวอย่างในรูปนะครับเราก็ได้มีการได้ใช้ในแบบนะครับที่มีตรงตามความต้องการนะครับของกลุ่มเป้าหมายที่อยู่ในแพลตฟอร์มนั้นๆอย่างเช่นใน Twitter เนี่ยคนก็อาจจะชอบแบบคนผู้ชายที่มีสุขภาพมีกล้ามมีอะไรเงี้ยครับเพื่อเป็นการดึงดูดให้เคสเข้ามาเห็นโปสเตอร์โปรโมทของเรา
So like from the post in Twitter, after they analyze and got like information what kind of media that the people like, they got develop it like to use the model that look handsome or muscular for the key population and attract them to get the information.
ครับและรูปกลับไปที่รูปตรงกลางเนี่ยครับก็จะเป็นหน้าโปรไฟล์ Account ใน Gay Dating Application นะครับเป็นของCBS เองนะครับแต่ละคน
And another picture in the third picture is the picture in Gay Dating application that the staff use it to reach to the people by their own.
ครับแล้วก็จะเห็นจากที่เราไฮไลท์นะครับก็จะมีการ มีข้อความที่เป็นการแนะนำให้เคสเข้าสู่บริการการได้รับชุดตรวจ HIV ด้วยตนเองครับ
And in the red highlight here is the information about to get the HIV self-test by themselves that they can direct message in the gay dating application.
ครับและเมื่อเคสเห็นเคสก็จะสนใจแล้วก็จะทักเข้ามาหาตัวเจ้าหน้าที่นะครับที่ให้บริการ
And when they're interested in the HIV self-test, they can direct message to the staff.
ครับแล้วก็ในภาพสุดท้ายก็เป็นตัวอย่างของเพจ Facebook M+ นะครับที่ตอนนี้ก็มีผู้ติดตามอยู่นะครับมากพอสมควรที่จะสามารถใช้โปรโมทเกี่ยวกับHIV Self Test ได้ด้วยครับ
And the last picture is the Facebook fan page of M+ Foundation that has a lot of followers, and they use it to promote about HIV self-test also in this channel.
และใดๆเมื่อถ้าเกิดว่าผู้รับบริการเนี่ยสนใจและเขาก็ติดต่อมาที่เราในลิงก์ถัดไปก็จะโชว์ให้เห็นถึงTest Me Now นะครับในการทำระบบการจองเพื่อติดต่อขอรับชุดตรวจ HIV ด้วยตนเองครับ
And when they're interested in any channel that we use online, and after they message to the staff will give them the link to Test Me Now, and they can use it to get HIV self-test by themselves.
ครับในที่นี้คือเคสอาจจะจองเข้ามาเองผ่านลิงก์เลยก็ได้หรือว่าให้เจ้าหน้าที่เป็นคนที่เป็นคนจองให้ครับ
They can get the HIV self-test by booking by themselves, or they can let the staff do it for them.
โอเคครับและเมื่อทำการจองเข้ามาในระบบแล้วนะครับระบบข้อมูลทุกอย่างนะครับก็จะถูกส่งเข้าไปที่ฐานข้อมูล Test Me Now นะครับที่สำหรับรับเคสนะครับ
And when they put the data or the staff put the data for them, it will fill into Test Me Now database.
ครับและต่อไปเราจะแสดงให้เห็นถึงในสไลด์ถัดไปครับอันนี้จะเป็นขั้นตอนการให้บริการนะครับเป็นขั้นตอนการให้บริการหลังจากที่ผู้รับบริการเนี่ยครับติดต่อเข้ามาบุ๊กเข้ามาแล้วผ่านทาง Test Me Now ครับ
And this is a survey processes after the booking and to the staff.
ครับเราจะมีทั้งหมด7ขั้นตอนนะครับเดี๋ยวไปที่ขั้นตอนที่1เลยครับ
And we all have 7 process to do this research test. Let's start with the first one.
ก็คือขั้นตอนแรกก็คือเราจะตรวจสอบข้อมูลการจองบริการในฐานข้อมูล Test Me Now ครับหน้าตาก็จะเป็นเหมือนรูปทางซ้ายเลย
The first step, we will do the verify of reservation information in the Test Me Now database system that show in the left slide here.
และเราก็จะไปที่ขั้นตอนที่2ก็คือเราก็จะโทรหานะครับเราจะดูข้อมูลสำคัญคือเบอร์โทรศัพท์นะครับเพื่อโทรหาผู้ทำการจองเพื่อคุยแล้วก็ประเมินนะครับแล้วก็ตกลงให้บริการ
And the next step, number 2, we will call to them by the telephone number and evaluate and give the service for them.
ครับโดยการที่เราคุยเราจะสอบถามว่าผู้ทำการจองมาเนี่ยได้จองมาจริงหรือเปล่าจองมาเองหรือเปล่าเพื่อตรวจสอบว่าเป็นตัวจริงนะครับ
So to call is to check that they will get the service, they really want to get the service or not.
ครับแล้วก็จะถามถึงว่าได้ทราบถึงบริการนี้ได้อย่างไรแล้วก็เหตุผลที่ต้องการรับบริการนี้ครับ
And ask about the reason that why they want to get this service.
ครับแล้วก็สอบถามประวัติการตรวจ HIV แล้วก็ประเมินครับ
And ask the information that they use to get the HIV test or not.
ครับแล้วก็สิ่งสำคัญคือต้องคุยในส่วนของเรื่องเกณฑ์การพิจารณาคุณสมบัติของผู้รับบริการ
And we will consider the qualification
ครับเกณฑ์ของการรับบริการเนี่ยจะมีด้วยกัน7 ข้อนะครับ
And there are 7 qualifications here.
ครับคืออย่างแรกเลยคือคุณจะต้องเป็นผู้ที่มีความเสี่ยงสูงนะครับเช่นคู่อินเด็กซ์นะครับเคมเซ็กหรือว่าเป็นปาร์ตี้เซ็กหรือว่าอยู่ในเดทติ้งแอปพลิเคชันนะครับ
The first one, you have to be in high risk group, like have the partner of index testing in the chemsex group or party sex sauna or in the dating application.
ครับและ2ก็คือเขาปฏิเสธที่จะมาเข้ารับตรวจบริการ HIV ในคลินิกหรือโรงพยาบาลครับ
And the next one is you refuse to get HIV test in clinic or hospital or you inconvenient to do it.
และข้อที่3คือสำคัญมากคือเขาจะต้องมีความเข้าใจอย่างดีกับเรื่องของ window period ของชุดตรวจเราครับ
And the next you have to have good understanding about the window period of HIV self-test.
ครับคือถ้าเกิดว่าเขาไม่มีความรู้เรื่องนี้เราจะต้องเป็นคนที่สื่อสารให้เขารู้เกี่ยวกับเรื่อง window period นี้ครับ
Because like if you don't have the knowledge about HIV self-test, the staff have to give you the knowledge.
ครับและก็ในกรณีใช้ยาต้านไวรัสอะไรอย่างเงี้ยครับก็คือจะไม่สามารถรับบริการได้และในส่วนของใครที่เคยกินยาเป๊ปยาเพล็ปมาก่อนเนี่ยครับก็ต้องกินเม็ดสุดท้ายเนี่ยนานเกินกว่า2 เดือนขึ้นไปครับ
And the person who on ART cannot get this service, and the people that get PrEPs or PEP have to take the last pill in the last 2 months.
ครับและ5ไม่เคยร่วมโครงการวัคซีน HIV มาก่อน
And for number 5, they never participate in HIV vaccination program.
แล้วก็ข้อ6ยินดีให้ข้อมูลสำคัญนะครับไม่ว่าจะเป็นชื่อจริงหรือเลขบัตรประชาชนแล้วก็ยินยอมให้เจ้าหน้าที่ติดตามในการตรวจด้วยตนเองครับ
And next, they have to give the information for the staff as their real name or national ID number for the staff to check.
แล้วก็ข้อสุดท้ายคือควรจะเป็นแบบคนที่อยู่แล้วแวกใกล้เคียงนะครับในพื้นที่จังหวัดของเรานะครับเพื่อง่ายต่อการติดตาม
And at number 7, that people should be in the same area of the site of clinic for easier to follow up and verification purpose.
แล้วก็ถ้าเกิดว่าเคสเนี่ยไม่ตรงตามไครทีเรียทั้ง7เนี่ยครับก็ให้เราเนี่ยต้องแจ้งเหตุผลกับเขาว่าเพราะเหตุใดถึงไม่สามารถให้บริการได้นะครับแล้วให้เราเสนอวิธีการตรวจ HIV ด้วยวิธีอื่นๆอาจจะไปบริการที่คลินิกหรือว่าใช้วิธีการตรวจด้วยตนเองแบบมีพี่เลี้ยงแทน
So if you are not in these 7 criteria, the staff will inform you to and propose other way to do the testing as to visit the clinic or do it with the staff.
ครับต่อไปลำดับที่3นะครับก็คือการบันทึกข้อมูลในฐานข้อมูลนะฮะก็คือ
Number 3 is to recording data in TestNow database.
คือข้อมูลสำคัญที่เราพูดถึงไปข้างต้นนะครับที่เคสจะต้องยินยอมให้ข้อมูลเนี่ยมันจะมีพวก UIC ของผู้รับบริการประเภทกลุ่มเป้าหมายช่องทางต่างๆที่เราพบเคสแล้วก็รวมไปถึงชื่อจริงแล้วก็เลขบัตรประจำตัวประชาชนด้วย
So the data that we'll put in TestNow database here is the UIC, the type of key population, the source that they see the information about HIV self-test, and also the real name with ID number.
แล้วก็ข้อมูลสำคัญที่สุดที่เราจะต้องได้มาอีกอย่างหนึ่งก็คือที่อยู่ในการจัดส่งชุดตรวจไปให้ที่บ้าน
And the important information that we need is address to deliver the HIV self-test to them.
หลังจากนั้นเราก็จะทำคำสั่งนะครับลำดับที่4ขั้นตอนที่4เราจะทำคำสั่งเพื่อจัดส่งชุดตรวจให้แก่ผู้รับบริการครับ
And the next step we make order to deliver the test kit to service recipient.
โดยเราจะนำข้อมูลการจัดส่งเหล่านี้นะครับไปที่เว็บไซต์ของบริษัทที่ทำการจัดส่งนะครับ INSTI นะครับ
and we will give this information to Insti for to deliver the HIV self-test.
โดยจะใช้เวลาประมาณ 2-3 วันในการจัดส่งชุดตรวจให้แก่ผู้รับบริการครับ
It took 2 or 3 days to deliver the HIV self-test to the recipient.
และก็ขั้นตอนต่อไปนะครับขั้นตอนที่ 5 เป็นขั้นตอนของการติดตามผลตรวจของผู้รับบริการ
And step number 5 will follow for result from service recipient.
นะครับคือกรณีที่ผลเป็น non reactive เนี่ยครับถ้าเกิดว่าเคสเนี่ยมีความเสี่ยงเกิน3 เดือนเนี่ยสามารถเชื่อถือผลดังกล่าวได้ให้เราบอกโดยวิธีการเน้นย้ำเรื่องการตรวจเป็นประจำนะครับแล้วก็สรุปข้อความสำคัญว่าทำไมต้องตรวจซ้ำแล้วก็เหตุผลที่ต้องมาตรวจซ้ำนั่นเองครับ
So for the test that is non-reactive and they got reached more than 3 months, we have to give them the information about to test regularly and give knowledge why they have to test regularly and also the information about HIV self-test
รวมถึงให้ข้อมูลความรู้เรื่องการป้องกัน HIV กับเขาด้วยครับ
and also give them the information for HIV prevention.
แต่ในกรณีที่ผลเป็น reactive หรือ invalid เนี่ยเราจะต้องอธิบายผลตรวจและข้อจำกัดของชุดตรวจนะครับ
In the case of reactive and invalid result, the staff will give them the information why the result is reactive and invalid.
รวมถึงดูแลสภาวะจิตใจพร้อมทั้งทำการประเมินทำร้ายตนเองหรือการฆ่าตัวตายครับ
And the staff will talk and take care of their emotion and assess if they will hurt themselves or have any intention to do the suicide.
ครับและให้อธิบายว่าเรื่องการตรวจด้วยตนเองเป็นเพียงการตรวจคัดกรองแล้วก็เน้นย้ำถึงความสำคัญและประโยชน์ของการตรวจยืนยันที่คลินิก
And give them the information that this is the primary testing and they have to do the testing again at clinical or site.
ครับผมต่อไปขั้นตอนที่ 6 ครับ
And next step, number 6.
ติดตามเพื่อไปรับการตรวจยืนยันนะครับเมื่อผลตรวจ reactive หรือ ครับ
And we follow up for confirmation of the result of the examination as reactive or invalid case.
ก็โดยการที่ให้เจ้าหน้าที่เนี่ยโทรติดตามนะครับในวันที่ทราบผลนะครับไม่ว่าจะเป็นช่องทางไหนก็ตามให้เราประเมินเกี่ยวกับโรคซึมเศร้านะครับ Q2 2Q 9Q 8Q นะครับ
And they will call at the day that they know the result and doing the depression assessment 2Q, 9Q, 8Q.
แล้วก็วิธีการตรวจยืนยันเนี่ยก็จะมีทั้งผู้รับบริการเนี่ยจองออนไลน์เข้าไปตรวจที่คลินิกเองหรือเจ้าหน้าที่เนี่ยเป็นผู้จองให้นะครับหรือผู้รับบริการเนี่ยเข้าไปที่คลินิกโดยที่ไม่ต้องจองล่วงหน้าหรือผู้รับบริการเนี่ยสามารถไปตรวจยืนยันเองที่สถานพยาบาลอื่นๆครับ
For the confirmation of the result, they can book and get the testing to the clinic or the staff book it for them. They can walk in or booking or they can do it with other hospital.
และเมื่อเทสไปตรวจแล้วเกิดผลออกมาเป็น positive นะครับก็จะสู่ขั้นตอนการที่ 7 ต่อไปก็คือเป็นการติดตามเพื่อเข้าไปรักษา HIV นั่นเอง
And when the case got the positive result, it will be to the next step that is follow up for HIV treatment.
ครับและเมื่อกระบวนการทุกอย่างเสร็จสิ้นนะครับทางเจ้าหน้าที่นะครับอย่างเราเนี่ยครับอย่างผมเนี่ยก็จะต้องไปทำการปิดเคสนะครับที่ฐานข้อมูลของ TestMeNow ครับ
And when all the case done, the staff have to verify that the information is correct and check information to plot the case in TestMeNow database.
และนี่ก็เป็นโฟลว์อย่างคร่าวๆของการทำงานHIV/ST ของ M+ ครับ
And this is all the flow that M+ work with HIV self-test. Thank you.
ขอบคุณครับคุณประยุน and thank you so much, Arm. So I think for the questions, we can wait until the end. Arm, if you don't mind, there are a couple of questions in the chat. If you don't mind writing them in Thai, so then Prayun can maybe answer or read those. And next up, we have Nikki Sullivan from Samesh, who will be sharing a presentation around HIV self-testing using vending machines in Australia. So hand over to you, Nikki.
Thank you, Matthew. I'll share my screen if that's okay. Okay, let me just get to the beginning. Okay, can everybody see that, or is it, what does that look like to you?
So we see the version, it's not the full screen version.
Oh, how do I do that then?
You can click on display settings on top if you can see. Can you see?
Yeah.
Display settings.
Yep, I can.
Click on that and then say swap presenter view and slide view.
Thank you. Okay, so yeah, my name's Nikki Sullivan and I'm the project coordinator here at SAMESH. SAMESH is the South Australian Mobilisation and Empowerment of Sexual Health. So we're a sexual health service that serves a range of communities, men who have sex with men, people who are HIV positive, and the LGBTIQA plus community more generally. I came on board specifically to develop and implement this project, which has been running now since, well, we started in October 2021. I'm speaking to you from Ghana country, and we always begin everything we do by acknowledging that we are on the lands of the Ghana people, that this land was never ceded, and it always was and always will be Ghana land. So I just wanted to give you a little bit of background about HIV notifications in Australia, because this is kind of, I guess, the backdrop against which this project developed. So in Australia, something like 1.7 people per 1,000 people were notified as being newly diagnosed in 2021. And as you can see, people from Southeast Asia, notification rates were much higher. Latin America and the Caribbean, a little bit lower, but still much higher than Australian born, and the same for sub-Saharan African populations in Australia. So what we see also is that people from those priority groups are much less likely to be diagnosed on time. So they're more likely to be diagnosed late than Australian-born gay and bisexual men who have sex with men, as are heterosexual people or people for whom their risk exposure is heterosexual sex. And the same is true for women. So these are all populations that in Australia have traditionally been quite difficult to reach, not least, I think, because they often assume that they're not at risk. We are working towards the 95, 95, 95 targets. And if we look at the 2018 data, which is the most recent I could find with regard to this, in terms of Australian-born populations, 94% of people living with HIV are diagnosed. 90% of those who are diagnosed are in treatment, and 96% of those who are in treatment or receiving treatment have achieved viral suppression. If we look at overseas born Australian populations, we see that those figures are not as great. So 85% of people living with HIV who are born overseas have been diagnosed. 85% of those are on treatment, and viral suppression is at 93%. So what does this mean, I guess, for us as an organisation that is trying to contribute to the elimination of HIV? Well, what we know is that we need to increase the uptake and the frequency of HIV testing, that without that, we're not going to reach those goals. And we know that we need to more effectively engage cultural and linguistically diverse populations and other priority populations. So the question has been for us, how do we do that? Well, one of the ways that we have tried to do that, and we are currently in the process of running this project, is to establish a pilot project that we've called Connect. So the Connect project uses vending machines to dispense free Atomo HIV self-test kits. They're the only self-test kits that are approved in Australia, and they are the finger prick tests. And what we're trying to evaluate is whether using vending machines to dispense these free kits will support rapid testing and strengthen pathways to treatment and support. And I think, you know, as all of the other data that shows from other similar projects, that Connect is working to do that. It is increasing testing amongst non and infrequent testers. And this initiative has been funded by the federal government as part of its activities to support the national response to bloodborne viruses and sexually transmissible infections. So we have had a relatively good budget that has enabled us to roll out what I think is quite an effective pilot project. So who are the target populations for this project? Well, you know, on the basis of the information that we have about who is most vulnerable, but also who we haven't so successfully reached in the past, the primary target groups for this project are gay, bisexual, and other men who have sex with men, especially GBMSM from culturally and linguistically diverse backgrounds, migrants, and international students living in South Australia. We know that there are barriers to testing, for everybody, but those barriers to testing are particularly, I guess, acute for people from culturally and linguistically diverse backgrounds. First of all, with regard to stigma and discrimination, some people come from, you know, cultural backgrounds where, I guess, same-sex attraction is perhaps even still illegal. We know that cost is a barrier for people who are Medicare ineligible. Tests like this cost money. We know that many people, particularly people who are on temporary visas, are very concerned that if they received a reactive or more particularly a positive result, that might impact negatively on their visa status. We know that people from some of the countries that we're trying to engage have low levels of sexual health literacy. We know that language is often a problem for people for whom English is not a first language. We know that people have often experienced negative clinical sort of encounters in the past and therefore really don't want to go to a clinic. We know that there's all sorts of cultural norms around gender, around sexuality, around all sorts of things that make it difficult for people to feel comfortable attending clinics and encountering people face to face when it comes to testing. We know that people have concerns around confidentiality and that often people really just don't have the time to make clinic appointments and you know, schedule them into their busy schedules. So our goal has been to overcome all of those barriers, or at least to do our best to do so. So some of the key components of the Connect project are that we set up a cultural advisory group, and that group has really worked hard to help us to understand their communities and how best to engage their communities and all of their diverse needs. We've translated all of our supporting documentation into 7 community languages, and we made decisions about those languages based on information that we received from Universities Australia, but also the advice that the community, that the Cultural Advisory Group members brought to the discussion. We purchased 5 vending machines and we installed these at university campuses. 4 of them are at university campuses and 1 of them is in a sex on premises venue that is Adelaide's only male-to-male sauna. We have a project web page which has all sorts of information, both sort of pre-testing and post-testing information. We had a huge social marketing campaign that involved promoting the initiative on things like platforms like Facebook and Instagram, on apps like Grindr and Scruff, and also on public transport and on street signage. We collect data about usage through the web app, which I'll talk more about in a minute, through Google Analytics and through a follow-up survey. And the project undergoes a project evaluation by a independent evaluator. All right. So what does Connect look like on the streets? These are just some images of the signage, just on sort of digital signboards on public transport. And that last picture there on your right is of one of our Connect vending machines, which are wall mounted and made specifically for us. So how does somebody get to access a free HIV self-test kit then? Well, they either scan the QR code on the machine or they scan a QR code on one of the promotional materials that they might encounter around the city. This will then take them to a web app that'll tell them about the Connect project and will ask them 4 questions, which they have to answer before they can go any further. So they are around age, country of birth, sexuality, and testing history. And they also have to provide a mobile number so that they can then receive a 4-digit code that they enter into the web app. Once they've done that, they're registered. They can then use any vending machine anytime they want, as often as they want, and they can access as many kits as they want. They simply go to whatever vending machine they choose and they scan the QR code and it will dispense a kit. On that kit, which actually looks like this, we've got sleeves that have a QR code that takes them back to the web page where they'll get information about, how to do the kit. That information, like I said before, is available in 7 community languages. There's also a video there that is subtitled, and that they'll find out there how to do it, what the results mean, what to do next once you've got your results. And then they're sort of reminded about regular testing and, all sorts of information about basically how to protect themselves moving forward. So to date, and this has changed a little bit since I made this a few days ago, we had 1,235 people registered to use Connect. We had dispensed 1,352 kits. And 10% of our users are repeat users. So now that we've been, the machines were installed in March last year. So we're starting to see repeat usage climb now. 17% of our users access more than 1 kit. And what we take that to mean is that they are actually giving kits to friends or potential sexual partners, which we think is a good thing, that sort of secondary dispensing, if you like. There's no eligibility criteria to use this service, and we don't collect any information about people's tests. They're not under any obligation to tell us anything about themselves other than age, place of birth, whether or not they've tested before. So we don't collect names, we don't collect national insurance numbers, nothing like that, because we think that all of those things actually present barriers to testing. So in terms of where our users are coming from, 50% of them are overseas born. The majority of the overseas born users are from an Asian country. So China, Hong Kong, India, the Philippines, and Vietnam account for about 2/3 of Asian born users. In terms of testing history, if you look at all of the locations that the vending machines are in, 63% of the users have never tested before. If we break that down to the university machines and the sauna machines, we'll see that people who having not tested before is much more common amongst university machine users than it is amongst sauna machine users. So only 38% of the people that use the sauna have not tested before. In terms of sexuality of users, you can see for yourself what it says there, but we've got a wide range of users, more so in the ones that the machines that are based in the universities than in the sauna-based machine, where 58% of the users are gay. Interestingly, 11% of the users of the sauna machine identify as heterosexual, even though they are in a venue where men go to have sex with men, which says a lot about what people are willing to share in terms of information about sexuality. In terms of sexuality and testing history, the data that we've collected tells us that 53% of gay and bisexual people have tested before, but that means that 47% of our gay and bisexual identified users have never tested before, which is significant and troubling. And 79% of our heterosexually identified users have never tested before. So just a few notable trends. We see that gay and bisexual users are slightly more likely to be Australian born and less likely to be born in an Asian country than in another overseas country. That our repeat users are 3 times more likely to identify as gay or bisexual than they are as heterosexual, which suggests that a lot of our heterosexual users are trying this once and then thinking they probably don't need to retest. 56% of users who identify as gay, bisexual, or men who have sex with men have never tested before. And like I said, that's something we're quite concerned about. And Connect has reached more users and a larger percentage of people who have not previously tested than any other vending machine project of this kind in the world. When it comes to user experience, the information that we've gathered from the follow-up survey, to which we have something like a 13% response rate, 78% of respondents said that they are extremely or very likely to use the HIV self-test kits again, and 95% of them said that they would recommend them to others. The top 3 reasons given for using Connect were: it's easy, it's free, and I could do it privately. To date, we've had 3 reported reactive results, and we have provided linkage to confirmatory testing and care. But like I said, that's as much as we can do because of confidentiality. We cannot access their records, and we don't require that they let us know what their test result was. The good news is that on the basis of the results so far, the Commonwealth government has just agreed to fund Connect for another 12 months. So we'll get to see, what usage looks like over a sort of a long-term period, which I think will be really useful. We'll get a sense of whether or not this is kind of a novelty and interest drops off, or whether or not what we do is kind of weed out the people who are less at risk and end up providing a service that is much more targeted ultimately. But yes, that's it. Hang on, stop sharing.
Thank you so much, Nikki, and to all the speakers. So I think there are a few questions in the chat. And maybe also, if others have any questions that they want to share, please raise your hand and then we can unmute you to share your question. Perhaps while we're waiting for others, Purvi, you might be able to answer some of the questions in the chat.
Hi, Matthew. before I get on to questions that that came for me, I wanted to actually speak about a question that I asked in the chat. It was regarding, what is HIV vaccination program that I read in one of the presentations, which referred to point number 5. I think it was the M+ presentation, and the response in the chat says injectable PrEP. So I just wanted to kind of clarify this, that injectable PrEP is not a HIV vaccine, and it should not be considered as a vaccination program. It is a prevention approach that should be used by key populations, by vulnerable populations, but it does not mean that it is a vaccination to prevent HIV. It can't be called as a vaccination. So please refrain from using this language and remove it from any material that you might be circulating it amongst your key populations, because it'll give a completely different message to people for what PrEP is actually used for. And so, I mean, this is I mean, I was a little taken aback. That is why I wanted to understand what they mean by a vaccination program for HIV. So, just a suggestion that kindly work on this and, rectify all the language and your materials in case you've circulated amongst the key populations. I see a couple of other questions. Sorry,
1
Matthew.
minute, Purvi. Yes, maybe Arm can just translate for
Okay.
Yun, if you don't mind.
Sure.
I do the translation for him in my direct message to him already.
Okay, perfect. Thank you. Go ahead, Purvi. And thank you for that clarification.
I see a couple of other questions in the chat for me, so I'll quickly go through them. Is non-reporting of results also present in other implementation models for other countries? Absolutely, yes. All countries face this challenge where key populations often do not get back with their reports or results. But it should not discourage you or the program, because it's not a mandate, even if it's not even a WHO recommendation or a mandate to get a result of a self-test kit from every client that uses a self-test kit. So please don't get discouraged if a lot of people are not reporting back. But what you can definitely do is try and set up some robust systems that can allow you to follow up with your clients, develop that kind of a rapport with your clients where they start feeling comfortable with you, and then probably maybe, may agree to share the result with you. So rather than having a mandatory criteria or a process of people having to report to you, develop skills of your outreach workers or virtual outreach workers to develop that rapport with the client so that they are comfortable in sharing the result. There are also these new artificial intelligence based reading technology that has come in for HIV self-testing, which is now currently being piloted in multiple countries, which allows the client to actually use an AI app, which will help them to interpret the results and also tell them next steps, talks about a lot of different things. So even those kind of technology related approaches are coming up into programs, and people are piloting it. And I think that will also improve the way people look at results, be more comfortable, feel that there is confidentiality that is maintained, and then they can take a decision whether they want to share the result with somebody, or how do they want to approach whatever their results are. The other question that I see is examples of follow-up mechanisms. So like I mentioned, there are countries that have trained their outreach workers to build rapport with clients. There are artificial intelligence techniques that have come up. There is also a photo share on WhatsApp kind of a system that has been generated. There are various different things that work for different countries. Again, depending upon the population that you're reaching, the comfort of your key population as well. Availability of internet for you to be able to do any kind of tech related reporting back methods. So it all depends upon a lot of context, and I think it needs to be planned and designed based on the key population needs, requirements, and your country context. So don't if something works in a country, you need to adapt it to your context. Don't just try and do the same thing just because it works in another country. Cost wise, I think these artificial intelligence might be like a one-time investment. if your country wants to do it as like a national scale up, it can be a one-time cost investment. But the other things that I mentioned, like a photograph, sending a photograph, training your virtual outreach workers, would not be very cost intensive and can be more sustainable as well. And the last question that I see for myself is about a test kit clear up management in Vietnam, especially regarding needles after they do blood tests. So every blood test kit that is available, the WHO PQ'd blood-based self-test kits have a disposal method as well. So it is not like the needles can be used, reused, or used for any other purposes. There is a specific disposal method that is available. And all the instructions are available in the sachet, and that actually helps in test kit clear up management as well. So adequate training, the kind of videos that we provide to our clients for demonstration of how to conduct the test, how to dispose of, should also, information like disposal should also be included in those videos so that people know what to do with those test kits and how to dispose them as well. I think these are the ones for me, Matthew, but if there's anything else that I've missed, please point it out and I'll be happy to answer.
Great, thank you so much, Purvi. I think that covers all of the questions for yourself. And I think for, there are a couple other questions in the chat that have now been responded to. But if anyone else has any questions that hasn't been responded to, could you please raise your hand? And we're happy to take other questions as well.
Matthew,
Yes,
I had
yes, please go ahead, Nikki.
a question for the second speakers about, you talked about the fact that your clients have to provide their name and their national identity number and things like that, which I think we would presume would constitute a huge barrier. Have you found that? Is there any evidence to suggest that, people get so far and once they find out they have to do that, then they say, oh, well, no, we don't want to be involved?
Okay, I will translate it to Prayun. พี่ปอยฝ้ายครับสำหรับคนที่เคยมาใช้บริการนะครับแล้วต้องกรอกข้อมูลพวกข้อมูลบัตรประชาชนชื่อพวกนี้นะครับเขามีที่แบบให้กรอกแล้วไม่ใช้บริการเลยไหมครับ
สวัสดีครับพูดถึงเรื่องข้อมูลนะครับ ข้อมูลของผู้มารับบริการเนี่ยโดยก่อนอื่นเนี่ยก่อนที่เราจะทำการรับบริการเนาะแบบข้อมูลเบื้องต้นมาที่จะมีที่อยู่อะไรอ่ะเราจะโทรไปคุยกับเขาก่อนจะโทรไปคุยถามว่าคุณสามารถให้ข้อมูลเหล่านี้ของเราได้หรือไม่ถ้าเกิดว่าคุณสามารถให้ข้อมูลเหล่านี้มันก็จะถูกตรงตามไครทีเรียเนาะแล้วเขาก็จะสามารถเข้ารับบริการได้แต่เคสสามารถปฏิเสธการรับบริการได้หากเขาไม่สามารถให้ข้อมูลใดๆของเราได้ครับ
Okay, so at first, before you get the service, the staff will call them and ask them if they agree to give the information about their name or that ID card number, because like it's in the criteria that we can give them the service. If they don't want to get the service, the staff will propose another way to get the HIV testing.
Great, thank you. Any other questions at this stage? There seems to be a question in the chat from Jonathan. Do you want to unmute yourself and share with the group?
Hello, good afternoon, good day to everyone. I would just like to ask, maybe you have some experience of convincing our international funders, partners to require less information from us for the HIV self-testing kits that they donate. Although it's very helpful that there's a big number of influx of HIV testing kits, but it would be impossible for us to distribute them anonymously with the current requirements for their M&E. So might there be a way to somehow negotiate less information collection?
I think if we're talking about say Connect, the way that we've justified that, I guess, is on the basis of research that shows that that in Australia that things like well, those barriers that hard to reach populations face are exactly that, those barriers around, you know, they don't want to have face-to-face interaction. They don't want to share their personal information. Even the telephone number is proving sometimes difficult for us. So I can see from the back end that often when people first register, they'll give an invalid mobile number. And it's only when they realize that the process won't move forward that they'll then re-register and put in a valid phone number. So when we report, well, first of all, we used, you know, research evidence that showed that the communities that we were trying to engage just would not engage if we made it you know, a mandate that they give us information about who they are. And then secondly, in our interim reporting, we have talked about that issue with the mobile number and the fact that this is just further evidence that people are very reluctant to provide personal information, and that if the main goal is to get people tested, then we don't need that information.
Thank you, Nikki.
Great, thank you for that question and response. Purvi, I see your hand up. Feel free to unmute yourself.
I just wanted to add to what Jonathan just asked and what Nikki just you know, responded. I just wanted to know, Jonathan, so as I understand, funders usually the kind of M&E that is required by funders is mainly a bifurcation of typology, age, disaggregation, and you know, maybe, I don't know, testing history maybe sometimes, but I don't think you really need to give like a client-wise information or a client-wise tracking data. Is it required, and which funder, if I may just ask? Because whatever systems I have seen so far, it's mainly disag based on age and sexuality probably, or you know, whatever typology they consider themselves, that kind of stuff. But if there's anything else, I would love to hear and learn.
Hello. I guess for just additional context, here in the Philippines, we're also relying on the national surveillance system. So that tool is already being used by the funders. So I guess it's just really it's a mix of the requirements of the government surveillance. They themselves collect the information, and to reduce systems that collect information, the funders have agreed to use that system also. So I guess there might not be that much way around it, because the state system for collecting information is already the one being used, for example, by Global Fund and PEPFAR.
Okay, yeah, I understand that aspect, but it's, you know, it's an advocacy issue, I guess, which needs to be taken up, and the government and the funders need to understand that when we are providing virtual, more anonymous options, it is important that we don't collect all this information, rather open it up for access to service. I mean, of course, it's a difficult thing to do, but maybe, you know, that could be one of the things that we want to put on our advocacy agenda. Thank you.
Great, thank you so much for that additional information. And I think this is a perfect segue to the next section around identifying what some of these barriers for HIV self-testing in your context. And so I've shared a Jamboard and the link, and I see from the Philippines, we've already had some participants. And so maybe we can just take 5 to 10 minutes and you can maybe share your experiences of personal barriers that you've identified in your country. So for example, there are no national guidelines around, you know, HIV self-testing to report the results. Or as what was just mentioned, the government processes require additional information like the unique identifier code. And so for SKPA 2, as we have 4 countries, I've tried to share the 4 different color post-its. And if you can maybe take some time to include your country, as well as what that barrier might be. And for countries outside of the SKPA countries, you can maybe use a yellow post-it. Purvi, do you have anything to add at this stage for this part of the agenda?
No, I just want to, tell people that, you can talk of any kind of barriers. It could be a kit registration in your country, availability of kits, where to get the funding from. It can be capacity building related barriers, or it could be like everybody has mentioned about reporting barriers. It can be anything related to self-testing that actually, talks about your challenges, to implement self-testing in your country. So we'd like to hear a range of them, actually. Thank you.
Great, thank you, Purvi. And in order to include a new post-it, there is a little sticky note or Control-Shift-P where you can add a new post-it and choose the color. And if you run out of space in this first board, at the top hand, there is an additional screen to include more post-its if needed. So we can take around 5 minutes if you don't mind for this. Great. I think it seems like we have a number of additions to the Jamboard, so thank you. I think we can see some related to cost, and so Medicare or healthcare ineligibility to access HIV self-testing kits, as well as the cost of the HIV self-test kit itself. So it seems like in Thailand that it's still quite expensive, and I'm sure that can also relate to other contexts where I've heard that from others, where the HIV self-testing kit may be expensive. And then also, it seems like we have a number of people who have included stigma as well as fear and cultural norms as a significant barrier, and we've heard that from the presentation today, as well as hesitancy from implementers or the service delivery org in allowing people to take the HIV self-testing, or fear that mental health related challenges if they get a reactive test. And so I think that's another area that we can see in terms of the barriers on the provider or service delivery organization side, maybe not trusting people to take the HIV self-test themselves without having a provider there. Purvi, I don't know if you want to share any of your feedback around some of these areas that have been identified as barriers at this stage. I know we're running a bit behind time.
There's also another common barrier that I see which is lack of awareness and demand for self-testing. I think that is also something that needs to be addressed in all these countries, which also talks of costing, So when I shared the list of WHO PQ kits, the lowest that we've got as of now is a $1 kit, which initially used to be like $4 or $5 or even cost a little more in certain countries due to whatever taxes, etc., get added on to imports of those kits. So one way of reducing the cost is if you can have a indigenous kit or a locally manufactured kit that can get a WHO pre-qualification, then the cost automatically comes down for your country. That's one option. The other option could be involving the private sector. So if the government is unable to fund a free self-testing program, it could be prioritized for certain populations to be free, but for other people, it could be like a like a subsidized program or a social marketing program where private pharmacies can be brought into the picture, manufacturers can be brought into the picture, where we can get a subsidized self-test kit which can be used for key population programs. So there are different ways in which this can be thought of, worked around. Even Global Fund Global Fund grant allows you to budget for self-test kits. So initially, if you want maybe for a year or a couple of years, you can do it through the Global Fund cycle, and then slowly try and integrate it into your domestic funding, and then have a combination of free versus paid private sector HIV self-testing as well. So there are different models that one can play around with. Again, very, very important to look at what the community wants, how the community wants to access it, and what is your country context. So all of this considered, we can definitely work on a model that works for your country. With regards to stigma discrimination, I think when we talk of stigma discrimination, I think self-testing itself is an answer to stigma discrimination. So when we talk of self-care options, when we talk of providing self-care options to people, I think that itself answers the big barrier of stigma discrimination that we've been facing for decades now. Allowing the person to access an option where they can test themselves and interpret their own results and then take a decision on how to move forward without answering any questions in terms of what's your sexuality, how many partners do you have, how many times do you have sex in a week, those kind of questions. I think that's the way in which our program needs to progress to be able to reach the unreached, never tested populations. And that's the way we'll be able to probably achieve our first 95 goals as well. And in terms of advocacy or demand creation, I think it is important that countries have a good demand creation campaign using social media, simple messages. I love what Connect has done with the kind of images that you have on the streets, how easy you've made somebody to order a self-test kit by just scanning a QR code. Those are things that people want to do today. They want to be tech savvy, tech-oriented approaches, which is simple, which is not asking too much information or does not need you to do too many things. I think those are the kind of approaches that we need to bring about. And of course, in terms of capacity building, I think healthcare providers, outreach workers, CBO members, everybody needs a full-fledged capacity building session on HIV self-testing, primarily to understand what self-testing is and not confuse it with community-based testing or index testing or social network-based testing, etc. And also how to use virtual interventions to improve access to self-testing. I think today the examples that we've seen, whether it was M+ or Connect, I think those are also the examples that I showed in my presentation are great examples of the use of virtual interventions for improving access to self-testing. And I think, our teams and staff needs to be trained and upgraded, updated about what's happening, what needs to be done next, rather than just following the traditional method. So I think a full-fledged capacity building on self-testing alongside virtual interventions would be definitely required for countries and program staff. That's my input, Matthew. That's all from my side. Thank you.
Great. Thank you so much, Purvi, as well as the speakers and everyone for their participation in this session. This is something that, we're thinking about, and we hope this is just the start of the conversation, especially for the SKPA 2 countries, where we can continue activities and support around this through the life of the program. I will now hand over to our technical director, Mike Merrigan, for some more closing words. Thank you.
Thank you very much, Matthew, and a big thank you to all of our esteemed presenters. Seeing as we're over time, I won't summarize all the sessions, but I'll just like to say a big special thanks, first of all, to Purvi Shah, who presented first from the UNAIDS WHO team on global and regional updates and experiences. Our second speaker was Kun Arm from the APCOM Foundation, who presented on the Test BKK campaign with his colleague from M+, Kun Pyun. And our third speaker, Dr. Nikki Sullivan from SAMESH on the Connect project and the distribution of self-test kits through the vending machines. So it was a very interesting presentation, hopefully for everybody. There was a lot of interest in the chat as well, and particularly around the reporting and follow-up of results. And here, Purvi and others clarified that this is completely voluntary and there's no expectation of reporting back from each test. However, reporting back is being made easier through making use of technology like artificial intelligence. However, we do have questions on whether reporting back results is going to be a barrier to utilizing the self-testing or getting HIV testing at all for people who have never been tested before. And we have seen data today that self-testing is really an effective way of reaching those people who have never been tested before. So thank you very much, Matthew and colleagues, and I wish you all a good day. And we look forward to the next webinar from the SKPA 2 project around 3 months from now.
Thank you, everyone.
Thank you so much, everyone. Have a good day. Thank you for coming.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.